Hey, so today I was going to do a video on something that's been plaguing me for months, which is my low back pain, which I originally thought was hip pain, but it turns out is actually low back pain. So I wanted to tell you all of the things that I've been doing to improve it and make it better, and hopefully some of this can help you. I will say right now, I am definitely not a doctor, and what is going on with me may not be going on with you, but I figured at least if I were able to kind of share what I've tried, if any of it's helpful, that's amazing. So this is the second time this has happened. So during my first pregnancy, every once in a while I get out of bed and I could barely walk. So I finally went to go see a chiropractor, and it was actually a really great experience. He kind of said, you don't really need to come in here. What's happening is your glutes and your thighs are so tight on one side that there's just not enough of this motion in your hips. So it's kind of, cramping everything up, and it's not allowing that kind of movement. So what you should do is use a foam roller, roll out your thighs every night, roll out your glutes. And that was actually great. It helped tremendously. And I continued to do that throughout pregnancy, and I never had to go back to him. So now for this pregnancy, it actually started a lot earlier. Because I had that in my back pocket, I would continue to do that. But it didn't help. It didn't provide that same kind of relief. So I'm here to share with you. I mean, I still do that, and it's one of the things on my list of what to try and what to do. But I'm going to go through all of the things that have at least helped me a lot more during this pregnancy. Now, the first thing that I did was I went to go see a chiropractor who unfortunately did not solve all of my problems in one visit, which happened last time. But she was really helpful and gave me a number of different tips, many of which I'll share with you. So the first thing is definitely try to be aware of your day-to-day activities and what aggravates the problem more than something else. For example, cleaning up the house. And I'm not just talking about sweeping some floors here and there. That's usually fine. But picking a whole bunch of things up, squatting constantly, unloading the laundry, things that they actually say you probably shouldn't do a lot of, at least in later pregnancy. Don't do those things, especially if you notice that it's going to aggravate you and take you out of commission for a day, 2 days. Also, what a great excuse to not have to really clean the house. I know it's kind of awful because at the same time you want to be nesting and setting up the nursery and doing all this stuff, but if you can't move after that, chill out. Just be like, hi honey, can you please move that? I'm preggers. And hopefully your partner is going to be amazing and be like, of course. Just ask really sweetly. Another thing, aside from the plagues of cleaning the house, is when you sit, make sure that your legs are even. So my office chair is actually one of those big balls that you can kind of need to, stabilize your abs a little bit and kind of have your pelvic floor support you. Which allows me to actually keep my legs on the ground really well. But I noticed that every single time that I sat at the dining room table, without fail, I would lift my leg up and sit almost cross-legged. That's a no-go. You can't do that. Or at least anything that ends up twisting your hips in that kind of way was really aggravating to me. So I had to train myself to, when I sit down, have myself be even. If I was going to sit on my couch, I had to sit on the couch and face forward. I can't kind of be twisting my hips and putting myself in a really bad position. So it removes some comfort positions. You just have to relearn and retrain yourself how to sit down in ways that are not going to really aggravate it. Another thing, keep moving. If you're just sitting at your desk all day, you're not getting that blood flow. You really need to keep moving around and change up the positions. So I can't sit for more than half an hour. I can't stand for more than half an hour. So you just constantly staying in motion or switching up positions has been really helpful. I'll actually probably do a whole different video on the different positions that I try to be in throughout the day. So those are just a few of the things that I was able to notice and switch around different stuff throughout the day in order to limit aggravating that area of my body. Now, I mentioned earlier that foam rolling was something that was pivotal to my previous pregnancy. And I do highly recommend that, especially if you have any tightness in your glutes or your thighs. Now, this one that I have is more foamy, so you can kind of dig your hands in and it moves. And last time that was fine for me. For whatever reason, this foamy one was not doing the trick this time. Maybe it's lost some of its luster. Maybe there's just too much deep tissue massage that I really need to get in there, but it hasn't been working. So I ended up investing in a one that's a little bit thicker and harder, and that's able to, when I roll it out, just get a little bit deeper in those muscles. Now, if you've never used a foam roller before, I'm just going to give you a very brief little how-to, but I'll also put a link to, give you more info if you want. So you're going to take your foam roller. You're going to start just above your knee. You never want to foam roll on the joints. You're only trying to hit the actual muscles. And you're basically going to put as much pressure as you can on the foam roller, and you're going to slowly roll up to your thighs. And most likely, you probably have some tension, and it's not going to be the most comfortable thing in the world. In fact, it'll probably be very uncomfortable. But I actually think it's very much like a killer massage where they're like really getting into the joints. To make it a little bit more intense, you can kind of lift up your leg a little bit once you hit a spot and move it around. But the idea is to sort of find a spot, spend a little bit of time there, either rolling it out. You can go back and forth. You can move your leg around. You can move the rest of your body. It is really helpful to have more than one other point of contact. So I usually try to have 3 other points of contact, especially while pregnant. So I have both my hands on the ground as well as my knee over here. The other thing that you can do, and you want to try to get as much of the tension that you can. I usually hold mine right on the bottom, like that, my outer thigh, as well as the front. The inner thigh is really hard to get with a foam roller. You can do it. But yeah, so good. So yeah, just play around with the different movements, especially when you're getting your outer thigh. It's great to move this leg further over, so this can support you. You definitely want to keep breathing. This is actually another great place to practice labor breathing, and just kind of taking slow, deep inhales through your belly and taking slow exhales, and that can be a really good prep for preparing yourself for contractions. So that's the best way to do your thighs. If you want to get your glutes, which also usually tends to hold a ton of tension, one thing that you can do is basically you sit on the foam roller, and the best way to get the most pressure and kind of letting your weight sort of hang into the foam roller is to grab one of your legs and put it over, and that's going to put more pressure on the roller, and you're able to roll it out a lot better. Now, there are definitely some spots that are much harder to get with the foam roller, and for that, and to get much deeper into the tissue, that's where the lacrosse ball is clutch. With the lacrosse ball, you're really able to get all into the deep inner workings of the fascia and the muscle, and you're able to, break up knots, in my opinion, a lot better. If you are very mobile, you can certainly lay on the ground and kind of do it. I saw this amazing yoga teacher once had us, put, 1 ball or 2 balls under your back, and she'd say, "Now swim like a mermaid." And it was actually this amazing thing, and it just loosened up all of the pressure down there. I'm currently not at a stage in my pregnancy where I feel super comfortable on the floor, so I recommend getting a lot of this stuff up on the wall while standing. So I'll show you that. So with the ball against the wall, you're basically just going to put the ball behind you, and you're just going to roll back and forth. You can reposition it, you can adjust, you find a spot, you find a knot. You can either try to tackle it directly, or you can kind of go around it depending on how it feels for you. If it's super painful, maybe try to go around it, and you're just trying to break up that tissue the same way that, a masseuse will go in and get into it. All the fascia that's all locked up. You're just trying to get it in there so it loosens up all of the muscles. So you can spend as much or as little time as you want, just kind of using your legs to roll your hips. You can obviously, I use this primarily for my legs, but you can also use it for your back. Just go up your back, move it around, and you're just using the pressure that you have against the wall. Now I use a lacrosse ball primarily because it's really hard. There's not a lot of give, so it allows you to like really get into the muscle. If it's too much and you need, less of that, a tennis ball will also work really well, or any other soft ball that kind of has more give. That's another option if, you need to get into smaller, tighter spaces, but the hardness of the lacrosse ball is just too much. So that's another option. So this is primarily what I use for, the top parts of my glutes, my lower back, that SI joint area. You never want to get like directly on the spine. You just want to get all the muscle around. If it's tense, you just spend a little time there, breathe through it. It can actually be a really good pain. The other thing that you can do is if you need to get more of the bottom, which is another thing I do, is you sit in a chair and you get it done there. Now, when you're going to just use a chair for it, you basically just put it under your bum, and then you're going to just roll around on top of it. It's a lot easier if you've got like a table to lean on, or, use your hands to prop you up, and that'll give you a little bit of relief. But yeah, you're just doing the same thing. You're rolling around, finding a spot. If you find a knot, going either around it or on top of it to try to loosen it up, and using your body weight to add the pressure. I do find that especially with the lacrosse ball, either on the wall or on a chair, if I'm experiencing a lot of pain, when I do that, I feel better at least a little bit almost immediately. So it does provide almost immediate help for the situation most of the time. But if you also get into the practice of doing this, for example, every night before you go to bed, it's also really great at just in general preventing it from happening. So I'm doing all these mobility things, and it's helping, but I still don't have the relief that I want. It's still, in flames every 2 to 3 days or so. So at the same time, I'm taking this orgasmic birth class, which is to saying like, use these yoni eggs to strengthen your vagina, or get some dildos and, poke around in there. So what I decided to do is invest in a pelvic floor wand, which you can certainly use it for other things. It does come with a vibrating version, which I didn't spend the extra $20 or $30 to get. But this is basically meant to massage out certain areas of your vagina in order to release tension points. And it turns out I definitely have some tension in my pelvic floor. But regardless, I still really wanted to work on my pelvic floor and not necessarily, willy-nilly play around with some toys. So I book an appointment with my old pelvic PT who I saw after I had my son, which was also really helpful. And there are a number of different tips that she also gave me. The first thing that she would be very disappointed if I didn't tell you is you should not technically use this while pregnant. The risk is that you might aggravate your cervix. The last thing that you want to do is poke around your cervix when you're pregnant. So you have to be careful. Luckily, most of the spots that I need to work are nowhere near my cervix, so I did get the go ahead to use it. And if you're interested in getting one of these, I will certainly put a link in the notes. The other thing that so far she's made a world of difference on for me is helping me to relax my pelvic floor. So the reason that you want to relax your pelvic floor during birth is because when it's all tight, it's not going to allow the baby to come through. This is one of the things that hypnobirthing is all about, so I highly suggest taking a course. One thing that I have noticed and learned is what I was thinking was relaxing my pelvic floor was actually tensing it up. So in attempting to do the right thing, I was not doing it properly. So when it comes to breathing, especially if you tend to spend much more time and effort trying to exhale, you really need to do a more passive exhale and a more passive release. And if you suspect that you might be having these same issues, you can kind of just, stick your finger in there and try to do an exhale the way that you would normally try to exhale to relax and see if your pelvic floor is actually relaxing or if it's tensing up. And when I'm clenching and tensing, then my glutes and all of that stuff is also tensing. So in just learning to relax a little bit more and relax properly, it's ultimately not making me tense up as much, and I'm able to not have my back aggravated as much. Since I have no idea what's going on with you and I'm not a medical professional anyway, I do highly recommend, if you're having a lot of issues, to seek professional help, whether it be a chiropractor or a PT or acupuncturist. All of those resources could really help you kind of learn what's going on with you. Ultimately, though, if you do have tense muscles, I do encourage you to try to work those out, as well as encouraging you to relax, because all of those things will allow your body to just be more prepared for birth. So that's it. If you want to get more healthy pregnancy tips or to follow my journey in a quest to have an orgasmic birth, please subscribe to my channel. And if you have any tips on how you've helped solve your SI joint pain, back pain, etc., please post them in the comments. And that's it. I hope you have a great day and hope to see you on the next one. Bye.